irrespective of religions and races. So you see, we have different religions, we have different opinions about the phenomenon of death, but death is a single phenomenon. So it cannot be of 5 types. So there is no methodological or scientific evidence in support of the finality, that is, end of total human existence with death. I must say with this, I did this work since 1999, and I even worked yesterday night too. So this is a huge work that I am presenting in very small slides. So sometimes you might feel like I'm jumping from one to another. Rather, most major religions were found to be against it, against the finality. Everything ends with death. That is the finality. Then how did we find the dictionary truth that death is our permanent cessation? So when we do not have much empirical way to research, we use epistemology, especially in case of psychology, clinical psychology, psychiatry, and Hamlin's theories of knowledge is a very special way to deal with these things. So Hamlin postulated 4 theories to identify truth, and I filtered the truth that dictionary said through Hamlin's 4 theories. And very briefly, the results were like this. The correspondence theory, this should not be a truth. The coherence theory, this should not be a truth. The utilitarian theory, this should not be a truth. And finally, the consensus theory that says the same. So it might seem funny to you that we are reading all those things in different established books, dictionaries, and even in the definition of death in jurisprudence book, but this man is saying otherwise. So sciences and major religions never demanded this as a truth either. So I propose my first hypothesis. Methodologically, for everyone, irrespective of religion and race, death should be regarded as an important event in human life without any sign of absolute cessation of existence contained within. This is the first one. But again, I ask myself, this is told in almost every major religion, then why am I telling this again? And I was asked this question from Bath University, one of the reviewers, who told me that what you are saying is told in different religions, so you don't need to tell about these things all over again. The answer was again a question. Do we practically believe in religions? Does our behavior reflect so? I don't think so. Again, question comes. Then how did the dictionary truth accommodate it in society? That dictionary truth is a very established one and naturalistically established one. Now, this part, this paragraph represents 3 years of my effort. After analyzing the history of the West of Middle Ages, mainly described by Philip Harris, and the stages of death adjustment for the aged or terminally ill, Elizabeth Kubler-Ross described those, I found some clue, and it took me 3 or 4 years to find these clues. I described that death as permanent cessation of existence can save humans from the dread of judgment of immoral activities in afterlife as promised in most major religions. And believe me, I found these things in the history, not from my mind. In a nutshell, when humans wanted to enjoy unbound materialism, they needed to get rid of moral bindings, therefore judgment, any kind of judgment in afterlife, and finally the whole afterlife. So, without any conscious effort, death became permanent cessation of existence, and that accommodated in our famous dictionaries. Parallel to it, permanent cessation of existence is a natural mismatch for humans, as I told you before. And death becomes an impossible truth for us therefore impossibly painful too, unless we deny it through our mental defenses. Just like we are saying that a cancer patient is going to die. But we all know that we all are going to die. Therefore, I had to propose a second hypothesis, and that was the better adoption of morality with restrained desire for materialistic life is needed for a satisfactory accommodation of an unending nature of death. So, I had to do some empirical work on this theory because it was, it was really a problem for me to go forward with this hypothesis, because everyone was saying that this is totally an abstract work and you didn't do anything empirical. So I studied 3 countries, Bangladesh, of course my country, India and Pakistan, and they showed some result in line of this hypothesis. I used the multidimensional fear of death scale, a very established one, as a tool for measuring the death anxieties among the people, and it showed, very interestingly, the following 5 were associated with lower death adjustment. Number 1, immorality. Number 2, higher materialism. Number 3, viewing death as absolute end that we do in everyday life. Number 4, non-compliance about death, like we don't want to talk about death. Simply this is a non-compliance. And negative attitude towards any judgment after death. These 5 factors were associated with lower death adjustment. Another thing, compliance about an information, that is morally tuned life resulting in a pleasant existence after death. Compliance about this thing was associated with lesser presence of those 5 factors. That is, it was associated with better death adjustment. So, after so many things, what is the use of this hypothesis? Why did I do these things, or how it can be utilized? Why am I here in a conference of palliative care? I think some minor utilities I can mention here. You can lessen the huge burden on medical and allied sciences striving to prevent death. I know one, probably, I'm not sure, probably one Korean doctor who is working in UK to prepare some medication for immortality. So if we are just with death, we don't need such medications anymore. And lessen the burden on psychiatry and allied sciences, as much of the mental illnesses can stem from death anxiety. And it was said by Ernest Becker, the Pulitzer Award winner. And he died the year I was born. This theory can help suicide prevention, because suicide comes from escapism, and there is no escapism in this theory. It can, though this is a bit different, it can reduce consumption, as lowering materialism would certainly lower consumption and help save the dying environment. We are so much concerned about saving our earth, and we can reduce our consumption as well. And finally, that we rarely think about, I don't think anyone thinks about it, and I talked to my beloved Professor Nizamuddin Sir a few days ago, that make the best use of death that we never think about. Death is useful. Do we think about it? So, in Kodak, I urge you all to restrain your materialism. Please bring morality back to life. It is the most essential component for a good life. And realize the utility and acceptability of death for a normal life. So, being a small man in this country, I thought about the aim of medical science. Can we shuffle it back to something else? What shall medical science do? Should it only lessen pain? Or should it lessen pain and continue life and therefore prevent death that we do in everyday medical practices? Preventing death is the main role of the doctor. Or should it lessen pain, accept death and adjust with it and work for the best quality of life? So thank you very much. This was a huge work presented in a very brief time, and these things can help you, especially my website and my email address. You can ask any question through email and I'll try to answer all those questions. So finally, I must say a small thing to you all, especially those people working in palliative care. Not only the patients are dying, that we heard again and again yesterday. They merely know a probable reason for their death. In fact, we all are dying sooner or later, and that can make palliation easier. Thank you very much.
Thank you, Dr. Hussain. Sorry. Thank you, Dr. Hussain, for your philosophical presentation in this session. Now, the last speaker.